Hey everyone, this is Dr. Alex Tubio. Welcome back to my channel. Make sure you comment, like, and subscribe. I'd really appreciate it. Today we are here with one of my patients, Jesse. We're gonna go through a lot of things with him, but he's had some amazing results because of the type of treatment that I've given him. So you're not gonna wanna miss this episode. All right, so let's get started. Alright, so we are here with Jesse, and Jesse was experiencing a lot of symptoms. There was a lot of things that were going on, not only physically, but also mentally as well too. And I'm going to let him go into it as well, because he's one of the rare cases of patients that I see come in through here with all of these symptoms presenting. Alright, so Jesse, go ahead and tell him exactly what you were feeling.
So basically, before I came in to see Dr. Tubio, I had a boatload of symptoms. They were pretty crippling. So basically, I was suffering from anxiety, panic attacks, insomnia, paranoia, extreme brain fog, fatigue, extremely forgetful. My memory lacked really bad, and that was a lot of the mental issues. As far as the physical issues, I was most of the time hunched back walking like this. I had a lot of back pain. A lot of the times at work, most of the time I have to stand at a counter like this. There would be a certain spot where pain would be concentrated, and you would always catch me shifting around to try to alleviate that pain one way or another. I just knew that something was wrong, but I didn't know exactly why. After treatment, the gradual symptoms that started going away immediately was all the pain that I was feeling on my back, all over my spine, within my shoulders and my neck. At first, it took a little bit of time for my body to readjust to the adjustments that Dr. Tubio was making, but shortly after, my body got the hang of it and I started to feel better noticeably. The pains were coming less and less and less, to a point where one day I just kind of woke up and I'm like, like my back no longer hurts anymore, and I don't have to stand like this or like this to get rid of that pain, because now I can, just stand straight how you're supposed to. And number two, a lot of the mental issues that I was having were clearing up actually. Because of all the adjustments that we're getting up here, I was able to sleep so much better through the night, because beforehand I was only getting like 3 to 4, maybe 5 hours of sleep. It would be constant toss and turn. I was in a haze where this heavy depression, because I could not get the sleep that I felt like I needed to get. I never woke up feeling refreshed until afterwards, where I would wake up and I felt way more better and ready to take on the day. And thank God I met Dr. Tubio, and he helped me discover the beauty of chiropractic care.
That's awesome. Jesse's one of the people that come to mind whenever I think about some amazing cases with patients. I mean, it's hard to always describe somebody that comes in here day in and day out and how awful they were at the time. And I say awful now because he's doing so much better. But even during our consultation, whenever he first came in, he couldn't even sit still in his chair. He had to move. He actually had to stand at some point. His head was hurting. He was really irritable. But what we do here is that we take x-rays first. So I always take x-rays on patients, especially because I want to see exactly what's going on with their structure. I don't ever like to go in blind and just really adjust somebody based on feel. I like to see specifically, almost like a blueprint of what I have to do, especially when it comes to a case like his, when he's experiencing so many different things. All right, so what I want to do is really go over the x-rays real quick. I'm not going to dive in too deep, but I want to show you guys exactly what he was experiencing, why he was experiencing it, and then how we were able to get him a lot better. All right, so we're going to go to the x-ray room and just show you a little bit of this. All right. So whenever we were looking at Jesse's x-rays, a lot of things stuck out. So whenever you were looking at his neck, and I always focus a lot on the neck because there's a lot of nerves that go from this neck region into your head that also control a lot of the different processes in your body. But whenever I'm looking at his neck over here, this portion was just absolutely straight. There was no curve. In an actual normal healthy person, the curve that you want, the ideal curve that you want in this cervical region is 43 degrees. So out of 43 degrees, he was at a 0 out of 43, which was 100% loss. That's a lot. That's no curve right there. A lot of these muscles are starting to be expanded. They're always being stretched in this back portion and through here. And then his atlas bone, the one that really surrounds that brainstem region, was only at 9.2. Normal is a 31. So a 9.2 out of 31. Things start to be hindered a lot from this area going into the head, especially when you don't have that curve now. Also, there was a lot of forward head posture in through here too. So if he was feeling tightness in the neck, experiencing a lot of those headaches, it's really because a compilation of a few things. One, the forward head posture going this way forward. The straight neck is the second one. And the third one is because of that atlas bone. Now, after treatment, what I wanted to show you guys is this. Whenever we look at this portion right in through here, his atlas bone changed from a 21.7, so basically a 22 degree, which is huge. That's 12 degrees of improvement. And then going from a 0 to now he has a 30.7 degrees. That is huge, right? And his forward head posture went from a 40 all the way down to a 12. You really want this number to be a 0, but he experienced a lot of change, and a lot of times, I mean, he was very consistent with his care. He did everything that he needed to do, the exercises, the stretches, the coming in, getting the adjustments that he needed. And that way he actually started to feel so much better. Isn't that right?
Yes.
Yeah. All right.
Very much.
Now, even with his mid-back, so I'm going to even translate more to his mid-back. In this first x-ray here on his mid-back, he was going off to this he was going off to this right. So when you're looking at this is your back region, this is your right, this is your left. This right region was going down far off to this right side, almost about 7 degrees to that right side. Whenever, after we were done with treatment here, this portion right here really shriveled down to a 3.8. So that wasn't going as bad anymore. So there's still a little bit of curve, but nothing that was comparable to this. So you can even see when I shift through these pictures and these images, it's just totally different, right? And then the last thing that I want to show you guys is the lower back region. Whenever we're looking at his lower back portion, so this is the before picture, you can see that it is fairly straight. There's about 18 degrees right here. Normal is about 40 degrees on this x-ray. So whenever we post x-rayed him, you can see that it went to a 33 instead of an 18. And now he obviously doesn't suffer from lower back. Amazing, right? It's funny how something has a correlation to it. I'm being very sarcastic, right? But it's really just a testament of how much that structure really determines the function of how your body is, how much pain that you're in, how much you're actually experiencing with digestive issues, with immune issues as well too. All right, and then another one, I just forgot about this one, is that the lower lumbar region as well too. So whenever we're looking at his lower lumbar region over here, this is his first x-ray here. His first x-ray, he was going really far off to this left side. His bones are really rotated this way. You can see this middle portion. You want that to be in the center of this box right here, but it's really rotated to this right side over here, pulling up this left side. So his left side was really, really tight. Afterwards, these are his post x-rays. So you went from a, these are his post x-rays afterwards. So you went from a 7.5 over here, and then went to a 4.8 over there. So that's some really, really awesome results. I mean, the curves really get worse if you really do nothing about it, especially with the things of daily stresses, daily lives, putting pressure on top of you. There's always gravity coming down on top of you. So we want to make sure that your system is clear, that we're working towards normal. There is an ideal state of where your spine is supposed to be. All right, so what I'm going to do now is go through an adjustment with Jesse. I just wanted to preface you on a lot of things that he was experiencing, but since we were able to take his x-rays, I don't have to really feel around as much, actually poke basically at him, but I can see exactly what happened with him, where I need to adjust, and also where not to adjust. Whenever you have someone like a scoliotic type patient, the worst thing that you ever want to do is adjust into the curve, make this curve even worse. You want to come on this side and actually push this down, bring it back to center. All right, so we're going to go and get adjusted now.
Cool.
All right, so now we're going to adjust Jesse. I'm going to go based on his x-rays, but you know, there's always still a feel for whenever I am adjusting somebody, because sometimes things might be hurting differently than a different point in time when the last time I adjusted them. All right, so what I'm going to have you do is you are going to go face down here. So whenever we looked at Jesse's x-rays, a lot of what was going on first, so I like to start from the bottom, really work my way up to the top. This left hip was shorter by 9 millimeters. You can refer back to the last few minutes ago there. But this left leg is shorter, so what I like to do first is loosen up a lot of the areas in through this low back. So I'm going to adjust this low back in through here. I'm also going to adjust this SI joint, this left SI joint. Now, whenever we're adjusting these things, I'm going to be using a drop table first. And the reason why I'm using the drop table first is because it's a lot more easier on the spine, a lot more easier on the system. I'm not having to twist or torque them just yet, but I am going to. It just depends on who the person is. But I am going to be contacting right here at this SI joint and just actually pushing this back up this way through here. Okay? So we're going to start here. You ready? Mm-hmm. We pressing right in through here. I'm going to contact here and stabilize right here. Good. Any pain when I do that? Mm-hmm. We're going to go right through here. Good. Good. One more time right here. Good. I'm going to be adjusting right on this left side. So this curve, whenever you're looking at this low back, go ahead and pan into this low back real quick. For him, in this x-ray, this lower back portion is going this way in through here. All right, so I'm going to be adjusting on this side, really pushing these vertebrae back down the opposite way. I'm rotating them. Right? So I'm going to start right in through here. Right here first. Good. Good. Right here. Good. How did that feel?
Good.
Good?
Yeah.
All right, so first I'm going to have you on your side, and then you're going to face me.
This one?
Yep. Have you keep this bottom leg straight this way. Good, I'm scooting forward here. I'm actually going to have you come on top of your shoulder a little bit. There we go. So I'm going to be contacting right back here on this side. I'm going to be tissue pulling up right here. I'm going to turn you a little bit, get you to that tension point first. Right here. Good. Just relax as much as you can. Good. 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 How'd that feel?
That felt really good.
Awesome.
Wow.
All right, now I'm going to have you go back on your stomach.
Okay.
So now I'm going to check this system through here. So whenever we were looking at his curvature, he went to the left here and then went back to that right side. So I'm going to be twisting this way right here, and I'm going to be turning, and I'm going to be pushing this way, okay? Good. And then good. How'd that feel?
That was a bit rough.
So there was a lot going on right there. So we're going to go right through this area. A little bit right in through here, so this is coming out this way. So I'm going to be placing my hand right here. All right, and I'm actually going to be turning this one just like this. Good. Just relax as much as you can. Good. Good. Okay? Mm-hmm. All right, now I'm going to have you on your back.
Okay.
right? Actually gonna lift this just a little bit. So I'm gonna start right here. All right?
Yeah, that's good.
Good. All right, and we're gonna start right into here. Right into this atlas region right here. Good. Good. Release this bottom portion right here. Good. You're all set, man.
All right, cool.
How you feel?
Really good.
Yeah?
Yeah, it's always a stress reliever right after that.
Yeah, that's awesome. Yeah, Jesse has a really hard physical job dealing with cars and parts and all that type of stuff. But yeah, so that is, basically, and we've done that a few times now, really harping on those main points that we need to, not just adjusting him and just trying to feel good, but really correcting the actual source and the actual structure of what's going on. All right, so that's pretty much it, right?
Yeah.
Yeah. All right, so if you guys have any questions or if you like what you just saw, please like, comment, and subscribe down below. I'd really appreciate it. Again, this is Dr. Alex Tubio. Until next time, guys, we'll see you later.